bring in Niall Dickson. He's the Chief Executive of the NHS Confederation. Thanks very much for being with us this afternoon on Sky News. What are your thoughts about this plan?
Well, I think this is a historic moment. The Prime Minister's right in that respect. And we certainly welcome the fact that after 10 years of the lowest funding ever that the health services had, we're now moving back to a situation where there will be a significant amount of extra money going in, not just on a year-by-year basis, but over the longer period of time. So all that is very much to be welcomed. I think we need to see some real detail about what will be in the NHS plan. I mean, some of us have been involved in helping to shape it, and I hope that the messages which we've tried to get through during this admittedly relatively short period where the plan's been drawn up have been listened to. In particular, the need to address the question of demand. We simply cannot go on providing new form of health delivery, which is much more based around GP and community services and social care than simply relying on very overstretched hospitals.
Neil, we've had a number of commentators on Sky News this morning who say that the worry is that extra promises can't be delivered and this extra money will really just go towards helping the NHS stand still.
Well, I think that's a question to ask. It's a question probably to ask both of our members who are having to deliver this, but also obviously in terms of government and the kind of direction that they're going to put forward. I think there's a real commitment in the service to move to new models of care because we can't simply go on as we are. There's no doubt in our minds that the money is not as much as we would have wanted. It's well below what we believe is necessary to really push extensive resources into the health service and to change it around. But we will have to live with what we've got, and it's a lot more than a lot of other public services have got, and it's certainly a lot more than we've received over the last decade or so.
Neil, Paul
I think there is a real
here.
challenge on the service. There's probably also a challenge for the public, the wider public. So people have to understand that the health service is going to face some tough choices going forward. This is not just a question of announcing one wonderful initiative after another. That would be absolutely the wrong way to greet this plan. We need to welcome it. We need to recognise that major change is needed as well as this significant investment. And we need to work with local populations to understand that the way services are delivered and perhaps the number of institutions that are around will have to change over the next 3 to 10 years.
Neil, it's Paul Kelso here. Good morning. I'm just picking up on that point about what's realistic for your members to deliver. The issue of the targets, the main targets against which the health service is both judged and organised around A&E, cancer referrals and routine operations. Do you think it's realistic to think that those targets, which are routinely missed, are ever going to be recovered at the same time as delivering all these new issues? The Prime Minister was slightly non-specific about that this morning. Do you think they will be hit in the lifetime of this plan?
Possibly in the lifetime of the plan. That's 10 years. If you take the 10-year horizon, if you're talking about the next 2 to 3 years, I think that would be unrealistic. And it would be unrealistic because if you focus simply on that, then you will miss all the other stuff that needs to be done in order to change the service around and make it sustainable. Nobody welcomes the fact that the NHS is not meeting its constitutional standards at the moment. And certainly there are too many targets at the moment. 400 targets or something like that. We need to rationalise that down and concentrate on those that are absolutely clinically right, and the government's got a review going into that at the moment. Of course, for the politicians, I entirely accept this is all very sensitive stuff, and missing targets is then, blamed on ministers. But I think we need to be realistic and not set the NHS undeliverable, so that's futile. So, of course, one might say over a period of time we will return to constitutional standards, but that has to be realistic and it has to be agreed with the service. The same actually is true of deficits. There are deficits around the NHS at the moment, and we'll be looking at how the government is planning to deal with this. And we know that the Treasury, well, indeed none of us, like the idea that parts of the NHS are in deficit, and it creates tensions at local level. So we will be looking at the detail of the plan about how they're going to deal with that problem over time. And also change the way in which they performance manage the NHS, because at the moment, hospitals and other places that are not doing well tend to be castigated, managers get moved on. We want to see a very different approach, which is much more supportive and recognises that some institutions do find it very difficult because of the circumstances that they're in, because the management is incompetent.
OK, Niall, I think your Skype connection needs a little bit of first aid, so we'll leave it there.